All right, today we're going to become medical detectives, and our main clue is this notebook, right from a fourth-year med student. See, hidden in these pages is the secret to one of the most powerful skills in all of medicine.
Okay, so let's just dive right in. I want you to think for a second, what is the single most powerful diagnostic tool in all of medicine? Is it some billion-dollar MRI machine, an advanced DNA sequencer, a super sophisticated lab? Yeah, the answer, it's probably not what you think.
The answer is actually hidden in plain sight, right here in these notes. It's not some high-tech gadget, nope. It's a good old-fashioned conversation. You know, that simple act of a doctor taking a patient's history, when they really take the time to ask the right questions and truly listen to the answers, that's where the magic happens. That's where the art of diagnosis begins.
Okay, so here's the plan for our investigation. First, we'll look at the doctor's #1 tool, their framework for getting the story. Then, we're going to apply it to 3 different case files: the chest pain puzzle, shortness of breath, and the clues hidden in a cough. And finally, we'll see how it all clicks together in the art of the diagnosis.
All right, let's jump right into our first section, the doctor's first tool. And you gotta understand, this isn't just some random chat. It's a highly structured investigation with a real framework designed to catch every single clue.
What you're looking at here is basically the doctor's secret playbook. This 8-step process, man, this is the foundation for every single investigation. It's this methodical search, right? It starts super focused on your main complaint, but then it zooms out to look at everything, your whole medical history, family stuff, any meds you're on. See? Every single step is there for a reason, to catch a clue.
Okay, so with that framework in mind, let's crack open our first case file. This one's a classic, the chest pain puzzle. And it's one of the most common reasons people rush to the ER. And let's be honest, the stakes couldn't be higher.
So the second you say the words chest pain, a doctor's brain just lights up with a whole lineup of potential suspects. In medicine, they call this a differential diagnosis. And as you can see, the list is long. I mean, it could be the big one, a heart attack, sure, but it could also be inflammation, a tear in a major blood vessel, or, hey, it could even be something like bad heartburn or a pulled muscle.
Now, the prime suspect, the one they have to check out immediately, is a myocardial infarction, or MI for short. That's just the fancy medical term for a heart attack. And all it really means is that a blockage in an artery has cut off the blood flow to the heart muscle itself.
And this is where the real detective work kicks in. Seriously, just a couple of smart questions can give you massive clues. For example, trying to tell the difference between angina, that's chest pain from narrowed arteries, and a full-blown heart attack. The doc will ask, how long did the pain stick around, and did any medication help? Because look at this. If the pain lasts for more than 30 minutes and doesn't get better with meds, well, that's a huge red flag for a heart attack.
And this is exactly why the words you use to describe your pain are so important. They are vital clues. If you say it feels like a squeezing or crushing pain, that points the detective straight towards the heart. But what if you say it's a sudden tearing pain that shoots to your back? Whoa! That suggests a totally different and just as dangerous culprit, an aortic dissection.
All right, let's shift gears and open our next case file. This one's another really common one, but it can be super complex to figure out. We're talking about shortness of breath.
Okay, so when someone's short of breath, the investigation hits a fork in the road right away. There are 2 main paths. Is the problem cardiac, meaning something's up with the heart's ability to pump blood? Or is it respiratory, a problem with the airways and the lungs themselves? Those first few questions are all about figuring out which path to follow.
And if that trail leads down the respiratory path, the questions get even more specific. So let's take 2 common lung conditions, asthma and COPD, which is basically a long-term disease that just makes it tough to breathe. To tell them apart, a doctor starts digging. How old were you when it started? Does anyone in your family have allergies? Are you a smoker? What's the pattern of the symptoms? See? Every answer helps build a much clearer picture of what's really going on.
And hey, just like we saw with chest pain, how your body responds to a treatment is another huge piece of evidence. So, if your breathing gets better after taking diuretics, water pills, that tells the doctor that fluid was probably backing up from the heart. But if an inhaler is what brings relief, well, that points a big flashing arrow right at an airway problem in the lungs.
All right, time for our third and final case file, the cough. I mean, we've all had one, right? But to a medical detective, a simple cough is just packed with crucial information. So the very first question a doctor asks splits the whole investigation in two. Is the cough dry or is it productive? Meaning, are you actually coughing anything up? A dry cough usually points towards things like a virus or maybe even acid reflux. But a productive cough, that makes the detective immediately suspect there's an infection brewing down in the lungs. Okay, so if the cough is productive, the doctor basically turns into a forensic analyst right there in the room. The color of the sputum, that's the stuff you cough up. It's almost like getting a lab result back. Yellow or green, probably a standard bacterial infection. But a rusty color? Wow, that is a classic clue for a very specific and pretty serious type of pneumonia. It's like the body's literally handing over the evidence.
So we followed the trail of clues in 3 different cases. Now it's time to zoom out and see how this all comes together. This is the big reveal, the art of the diagnosis.
Yeah, see, the investigation is never just about the one thing that made you come in. A good doctor builds a complete profile, and they do it by pulling in all that data from the 8-step framework we talked about at the beginning. Your past conditions, your family's health history, any medications you're on, even your job or if you smoke, all of it. It's all part of the puzzle.
And this is the heart of it, right here. The whole diagnostic process is really just a methodical process of elimination. The doctor starts with this huge list of suspects, and then, clue by clue, story by story, they just start crossing them off the list, one by one, until only the most likely answer is left standing. And in the end, it all comes back to this one simple but really profound idea you hear in medicine all the time. The patient will tell you the diagnosis, you just have to know how to ask. It's such a powerful reminder, isn't it? That in this crazy high-tech world we live in, the most important tool for figuring out what's wrong is still just a conversation. Which kind of leaves you with one last question. Are we all listening closely enough?